Well, this is a classic situation where we've got to balance out the mental health concerns with the physical health concerns. And really, we want two things as human beings. We want certainty and we want human contact. They are two things that, by and large, have been denied us as human beings on a number of occasions through the last 7-8 months during COVID. And for these people you're referring to in Adelaide, they're about to be in quarantine without any significant, if any, human contact beyond electronic forms. So it is very difficult, and we do need to make sure that people who are in that very isolated environment are getting the mental health support they need. We don't want them coming out physically okay, but mentally unwell.
And how isolating can this experience be?
Oh, incredibly isolating. For the 57 years that Lifeline has operated, we've received millions of telephone calls from people who are lonely. Today, we'll get scores of calls from people who are lonely, for whom Lifeline is potentially the only voice they speak to all day. Now, people no doubt in quarantine will have devices and be able to contact people, but nothing is better than face-to-face, one-on-one communication. It's what we all crave. It's what we need. We're very, in that sense, we're very needy human beings. So it is something that, loneliness is something that we've always been concerned about during the shutdown or lockdown periods. Indeed, when I hear the words physical isolation, when I hear those words, I think the words enforced loneliness. So this will be very difficult for people. I know that it's got to happen. We all know it's got to happen. We all know that this level of quarantining has been one of the absolute keys to our success in Australia. But we shouldn't neglect people's mental health, and there are things that can be done to support them mentally.
You certainly feel for them. 4 weeks in a hotel room would be incredibly, very, very difficult. John, I want to ask you about some research from Britain's Oxford University. It's found that 20% of people who have been infected with the virus develop a psychiatric disorder within 90 days. Were you surprised by this?
No, not really. If those people who are diagnosed with COVID then go into isolation, all of the same things I've just said before apply in terms of people's loneliness and enforced loneliness and lack of certainty. The other point is we all want certainty. We're very simple. We want to know what's happening tomorrow, next week, next month, next year. Those things are very important to us. And when you're given a diagnosis of COVID that could in fact lead to greater physical illness, or death, frankly. And in the UK, of course, the experience is a much higher death rate than it is here in Australia. Then with those factors in play, there is a high likelihood that people become anxious, and that leads to a clinical anxiety, that they become depressed, and that leads to a depressive illness and all of the consequences that come with that. It's always been the case that significant shocks, if you like, to people's physical health do bring on the risk of mental illness as well. So, look, it doesn't surprise me. What we've found at Lifeline over the last 9 months is an increase in our calls by an average of 20%. So this time last year, we would be taking 2,500 calls a day. Yesterday, we took 3,000 calls, almost perfectly 3,000 calls. Wow. We've been as high as 3,300 calls at the peak of COVID. So people are reaching out. The good news, Danita, is both in New South Wales and Queensland and Victoria now, we have seen the coroners report very publicly that there has been no real increase on year-on-year suicide through the COVID period. Yeah. So what I hope that message is telling us is that people have thrown off the stigma of being worried about what will people think about their mental health. They've put their hand up and come to Lifeline. They've gone to see their GP or a counsellor, confided in friends, seen other organisations, and they've stopped short of taking their own life. So in all of the negative news or all of the downside of COVID, one of the upsides is that, yes, our mental health system has been under enormous stress as a consequence of these overwhelming numbers, but it means people are reaching out. They're not embarrassed. They're not ashamed. They don't feel they should. They don't feel they've failed. All of these things mean that people are more conscious about their mental health and they're more open about their mental health. Absolutely. And they're coming to organisations like Lifeline and getting the help they need and stopping short of suicide. Yeah. My concern is let's hope we're close to this physical pandemic being finished.
Of course.
Following this physical pandemic, we should expect a mental health pandemic that will last for 2 years at least, where people have to adjust to some form of new normal. Their job won't be back for them. If there's a job for them, it'll be different or completely changed to what they used to do. They mightn't be able to pay their rent, pay their mortgage. So what I'm saying, without being a doomsdayer, is that we will see the mental health crisis worsen after the physical health crisis is dealt with.